Inside Metro West Medical Center, Bob Speen of Framingham lies quietly on a gurney listening to Frank Sinatra. He is here because a portion of his right coronary artery is 90% blocked by bits of fat and cholesterol called plaque. While the 76-year-old is not in immediate danger, his heart is not getting enough oxygen-rich blood, leaving him at risk of chest pain or a heart attack down the road. So Dr. James Alderman and his cardiology team are performing an angioplasty. They begin by feeding a series of wires and thin tubes called catheters into an incision near Speen's groin, following his femoral artery and the aorta into the right coronary artery.
This part of the catheter, so from up there down to here is one tube, one hollow tube.
Once everything is set up, Alderman plans to inflate tiny balloons to push the vessel outward, restoring normal blood flow. To ensure a longer-lasting fix, he also hopes to place a small piece of collapsible mesh wire called a stent at the blockage. The device will be expanded by a balloon, which will then be removed with the wires and tubes. To inflate the balloons, Alderman and technician Angela Powers will send air pressure down the catheters.
We usually inflate a balloon to about 8 atmospheres, 4 times the pressure that's inside your car tires.
After opening the blockage with balloons, Alderman tries a stent.
2 marks. Now, in between the 2 marks, you see a shady area, that's the metal stent mounted, crimped onto the balloon. And now we're going to try to get this stent across this narrowing.
The stent is nearly in place when the team hits an obstacle, an arterial curve right where they need to anchor the device.
So it looks straight in this two-dimensional view, but if you were to look at another angle, you'd see that it's really like that. It's just when you look at it like that, it's straight, but it's really very curved. And these stiff catheters go into here and don't go around the curve. And I've already opened up the blockage, but I really need the stent that I put in to go just a little bit further.
Alderman decides to take out all the wires and tubes and start over with a new set of equipment.
AL.75, 75. So, Bob, I'm going to change the sheath for a larger one, so you're going to feel a lot of pressure here, okay?
After nearly 2.5 hours, the team is ready for another stent attempt, likely their last before calling it a day.
Okay, go ahead and expand that.
Going up.
14. Beautiful. And down.
Down.
We got a step
18.
down. We got a step. A lot of work, but we did it.